And along with teaching at Dawson, I used to write a photography column for the Gazette. And I mention this because Neil said, "Oh, are you the Martin Coles that used to write for the Gazette?" And yes, I am that person, but he may be the only person in the room that ever read my column in the Gazette. Okay, got it. I'm recording. So what I'm going to talk about today is irreversible electroporation, which is shortened to IRE, and electrochemotherapy, which is shortened to ECT. You may have heard ECT as an acronym and as an acronym for electroconvulsive therapy, a way of treating the brain. But this uses the same three letters, but it's a treatment for cancer. And I'm talking about these as alternatives for treatments for prostate cancer. And some of you, after hearing my presentation, and some of you who've undergone the standard conventional Canadian treatment might well say, "Why didn't you tell me this 3 years ago?" Well, I didn't know I was going to do this 3 years ago. So I underwent ECT treatment at the Vitus Privat Clinic in Offenbach, Germany. Offenbach is, it's the other side of the River Main from Frankfurt. So it's easier to say it's Frankfurt. I think most of the time I'll say treatment in Frankfurt. And the clinic is also called the Vitus Prostate Center. Okay, so you've all read the words private clinic. And I imagine that you've all managed to translate that from the original German into private clinic. So there's a thought that's come into your mind straight away. So let's deal with that thought that's uppermost in your mind. How much? Private clinic, how much? There's good news and bad news. The good news is that I eventually received $11,000 in federal and provincial tax credits. The bad news is that I paid over 36,000 Canadian dollars for the treatment in Germany. But with the tax credits, it was about 25,000. So if anybody goes this route, hang on to every single receipt for your medical expenses, everything that's to do with going to this clinic. And you have to make sure that the clinic gives you the full receipts for what they did, because you're more or less guaranteed to have a mini audit if you submit this much money on your tax form at the end of the year. The feds and the provincial people will be tracking you down and saying, "Send us the receipts before we'll give you all this money." Okay, so if you go this route, hang on to every receipt, make sure you can justify the $36,000 claim. So the other thought that's uppermost in your mind is the Vitus Clinic a serious medical facility, or is it some kind of, ground up apricot pits and chanting all day long? Okay. The director is Michael Schelling, and he's currently the University Professor of Radiology in Jerusalem. He's a former Harvard Medical School fellow, and he was the Associate Professor of Radiology in Boston. So he's got qualifications and expertise from all these places. You can't really beat Harvard and Boston. That's pretty good. Here's the man himself. Would you trust this man? He's clearly trying to look trustworthy, isn't he? He's also looking rather squished on this screen. That's a technical problem we weren't able to solve. For those of you online, you're seeing the man in the right shape. Okay. But and to add to his qualifications, when he was a medical student, when he was a PhD student, he worked with a guy called Peter Mansfield, Sir Peter Mansfield, one of the two people who invented MRI. So he's known all about MRI since the beginning, medical resonance imaging. And he set up his clinic in 2011, that's 12 years ago. As an indication of how serious this place is, they have their own MRI scanner. The Jewish has one scanner, each hospital has a scanner, but this is just a relatively small clinic, it takes 2 floors in a fairly small building in Offenbach, but they have their own scanner. They're taking this very seriously. And from my experience as a patient, I think it's highly professional. It's definitely a serious medical center. They sent me an enormous list of medical tests that they wanted me to undergo before they would even consider proceeding with the surgery. It cost me a fortune just for the tests that they demanded. In fact, my GP looked at one of the tests and he said, I'm not quite sure what this is. So they're very thorough. They're very German about everything. So here's my story.
Sorry, Martin. The tests you did them here, or you have to go to Germany?
Yes, please feel free to interrupt with these questions. The test I did here in Montreal, this was before I even got on the plane to go to Germany. They weren't even going to give me an appointment date unless they felt that there was a reasonable chance of me surviving the operation. They didn't want me to spoil their track record. And I went to my GP and he said, this will take you years to get it done through the hospitals. You'd be better off to pay for these tests yourself. So I went to a private clinic and I paid $1,600 for all the tests they wanted, heart tests and everything, very serious. So yes, that's a good question. But the testing was done 2 or 3 months. In fact, I think the testing was done before we even scheduled a date for the procedure. So here's my story. I was diagnosed with a small prostate tumor in 2017, 6 years ago. And I had HIFU treatment at the Jewish with Dr. Anijar. Do you know what HIFU treatment is? Have you had sessions on it?
No, I don't know.
Anybody want it? HIFU stands for high intensity focused ultrasound. It's what's called a focal treatment for just one small tumor in the prostate. And Dr. Anijar is one of the few people that's using HIFU treatment here in Canada. So I was kind of fortunate to have that. But by 2022, the MRI scan showed that the tumor had continued to grow despite the HIFU treatment, and it was growing on the other side of the prostate as well. And as I'm sure you all know, by the time it's in 2 places instead of 1, that's 1 notch more serious than just having it in 1 place. So Dr. Anijar was recommending radiation treatment. He wanted to pass me over to the radiation department. I'm not sure whether they were going to have recommended the seed method or the external beam. I didn't even get that far because I thought I simply don't want to undertake the risks associated with radiation treatment. And I'll tell you why. Now, before I was even preparing this presentation, I got a very handy piece of advice from John Warren, and this is what he said to me. There's no need to tell them where the prostate is. They already know. So I'll simply remind you where the prostate is. It surrounds the urethra and it touches the bladder and the colon. And that's what makes any kind of radiation treatment or radical prostatectomy hazardous because of the placement of the prostate. God put it in an inconvenient place. So if you use either seed radiation or external beam, you can end up with incontinence or impotence, and the treatment can cause colon cancer or bladder cancer. Sometimes people end up with cancer two years after the treatment. They've got cancer in the colon. So I didn't want to take that risk. And of course, I was too old for prostatectomy, so that wasn't even considered. But if anyone is contemplating these standard kinds of treatments in Canada, I would recommend IRE or ECT. Now, I'm just the opinion of someone who's gone to the clinic and undergone the treatment, but it seems to me that it works. How did I find out about the Vitus Prostate Center? As it happens, my older brother, Julian, was diagnosed with prostate cancer, I think in 2018. And he did some serious research. He's the kind of person who spends hours on the internet finding out everything there is to know. And from his research, he found out about the Vitus Clinic and underwent IRE. Remember, that's the Irreversible Electroporation. He underwent that treatment the same year. So when I was faced with the prospect of radiation treatment here at the Jewish, I decided to follow my brother's footsteps to Frankfurt. Okay, so IRE and ECT are similar kinds of treatment. For both of them, a tissue ablation procedure called nanoknife is used. Nanoknife is kind of the brand name. They came up with a fancy name, meaning very precise, very accurate work with a, in this case, not a physical knife, but an electrical knife. So both of them use the nanoknife precision, and nanoknife involves inserting pairs of electrodes. They use more than 2 electrodes because you've got to get to different parts of the prostate, but inserting pairs of electrodes using the guidance. In the clinic, they take an MRI scan the day before the operation. They prefer them MRI scans to anybody else's scans, and they like to have the most recent version. And of course, they use ultrasound as well to guide the placement of the needles. And the needles are inserted through the perineum. It's transperineal insertion of the pairs of electrodes. 3,000 volts are used, 1,500 positive on one needle, 1,500 negative on the other. The patient happily remains at 0 volts. These voltages might sound life-threatening, but the duration of the pulse is measured in millionths of a second. So it's very carefully controlled. They obviously want you to be alive at the end of it. So that's the procedure. A pair of electrodes inserted into the prostate through the perineum, and then 3,000 volts zapping between the 2 of them. And guess what? That voltage damages the cells. And that damage is called electroporation, because what the result is you get holes in the cell walls. That's the poration. It's a fancy word meaning electrically burning holes in the sides of the cells. And cancer cells are more susceptible to this electroporation than regular cells, and they're therefore more easily ablated. So unfortunately, fortunately, and the whole point of this procedure is that the ablation is limited to what lies between the 2 electrodes, the 2 inserted electrodes. So you're sparing the surrounding tissue because the damage can only be between the 2 electrodes. That's why you don't have the spread of hazard spreading to the bladder or the colon or other surrounding tissue. Now, IRE stands for Irreversible Electroporation. It should be IE, I suppose, but they call it IRE to make it more memorable. Irreversible, that means it can't go back. They zap the cancer cells with enough electricity that the cancer cells will die on the spot. Okay? This is what my brother received, and he's happy with the results. He's up and about and doing well. Well, it was 5 years ago that he had his treatment, and he seems to be fine with it.
What's his, do you know what his PSA is?
Oh, now, what his PSA now is, I don't. And I don't for somewhat personal to him reason. You might not agree with this, but he's decided to stop having his PSA measured. He's had the treatment. He's no longer so. But he did tell me, yes, he did have a PSA when he came back, and it was 0.4 or something like that, way low. But I'll tell you what mine was in a short while. It does drop the PSA by a very significant amount, and his dropped, and I don't remember how much his dropped. But I can't tell you whether it's rising now because he's made the decision to just live his life and take what comes. Now, as part of the treatment procedure, what you get for your 36,000 less 11,000, you get a 1-hour meeting with the man himself the day before. He makes this part of the procedure, so you're fully informed of what's going on. And when I met with Dr. Sterling, he said that the result of the MRI done the day before was such that the spread was too much to be treated with IRE. So he was going to use the other treatment that he does, which is called ECT. There will be a test at the end, by the way, and you'll have to know this word, electrochemotherapy, which involves running a smaller current between the pairs of electrodes. Now, the current is not, it's sufficient to cause electroporation. If you remember, that means causing holes in the cells, but it's not irreversible. If that was all that happened, the cells would recover and go on their merry way. But what they do is, at the same time, they give you an intravenous infusion of chemotherapeutic agents. But in my case, I was given bleomycin. And it's the same kind of chemotherapy agents that you would get if you were undergoing chemotherapy. But instead of having a dose a day, 5 days a week for 6 weeks, you get the one single dose of the chemotherapy agent. And because the cancer cells have been opened up with the electric currents, they pass into the cancer cells, killing them. And the effects of the agent that they put into your bloodstream, it's up to 1,000 times more powerful than the effect of those same chemicals on the rest of your body. So you don't, or I didn't, undergo any of the classic side effects of chemotherapy. I never had the possibility of hair loss or any of that kind of stuff, because I was just getting the one dose at the same time as the zapping of the cancer cells to make them more susceptible to the work of the chemotherapy agents. And as I said earlier on, I received bleomycin, which is a standard chemotherapy drug for lymphoma. It's mainly used for testicular cancer, but it's also used for ovarian cancer and cervical cancer. But I believe it's mainly used for testicular cancer as a, once a day for 6 weeks kind of treatment. I flew to Frankfurt in the summer of 2022, and the treatment I received is excellent. Guess what? When you pay that much money, you get really good treatment. Everyone speaks excellent English. They wouldn't hire, the nurses that they hire, the doctors speak perfect English, but the nurses all speak good English. They understand how much money they're getting from patients coming from Canada and the US and England, so they make sure that everybody can speak good English. As I've already mentioned, I met with Dr. Stelling for an hour-long discussion before the surgery, and he explained what he was going to do and why. And after the surgery, Dr. Heringer, who was the urologist that was assisting during the surgery, the next day he came to see me and he handed me his business card and he says, "Call me on my cell if you have any problems." Now, raise your hand if any of your doctors have ever said, "Call me on my cell phone if you ever have problems." I noticed that nobody's raised their hands. You sort of had. You got that?
Text and call, actually.
You could call him?
Yeah.
Okay, that's better than I get, by the way. I think it's pretty rare. I think we can agree that you're lucky if the doctor gives you his cell phone number. So after I left the clinic, I flew to Marseille and my brother drove me to his home. He lives in the south of France, just an hour north of Avignon. So I spent some time with him recuperating. It was really handy that he could pick me up. It was easier than taking a flight all the way back to Canada, although of course you can do it. As it happened, my body didn't like the catheter. I don't know whether I'm sure you've all had catheters. I don't know how well you tolerated them, but my body tried to reject the catheter. It didn't like the catheter. So I had a lot of pain. I even ended up in the emergency ward in the Montélimar hospital. By the way, the French medical system is really, really good. I got to see an emergency doctor in Montélimar pretty quickly, and it didn't cost me much, 65 euros or something for the visit. And that, of course, expense got put onto the total medical expense bill that I handed in at the end of the year. But I have to say the French medical system, from my experiences, works really well. So it was about 6 weeks before the pain fully went away. As I say, it was all due to my body saying, no, I don't like this catheter. If my body had been more tolerant of the catheter, I would have recovered a lot more quickly. So we're now getting to what John wants to know. When I got back to Montreal, Dr. Anijar sent me for a PSA test. Before the surgery, I was at 11.5. After the surgery, I was at 0.32. Now, that's a pretty impressive drop, considering they didn't remove the prostate, they just removed the cancer cells. So I still have a prostate, which means I still have urinary urgency, but I still have a prostate. So that's my situation. I think these numbers speak for themselves. I think this computer speaks for itself. Now, my PSA levels have crept up a little bit since then, and I might need further treatment, in which case I'll probably go back to Offenbach. Remember, it's Offenbach, which part of Frankfurt, if I can afford it. Because the Vitas Clinic also offers ECT treatment for recurrences of prostate cancer in the prostate bed. The prostate bed is the tissue area that surrounds the prostate. And radiation treatment for the prostate bed is particularly dangerous, in my opinion, because it really is close to the sensitive because there's a lot of sensitive tissues right very close to the prostate bed. But as I said, as I keep repeating, because it's ECT treatment, the treatment is limited to what's between the electrodes. And you can have it as often as you like, well, as often as you can afford. And even if it doesn't work, you can always go back to the conventional methods without restriction. So you haven't closed the door to radiation treatments of all kinds if you go this route first. So if you want to find more about the clinic, just Google Vitas Clinic. By the way, the invitation to this meeting included a link to the Vitas Clinic. Is that what you were about to say?
No, I'm wondering if you have met any other men who have this treatment.
How many men?
Have you met any other men?
No, I've not met anybody except for my brother who's had this treatment. I believe they've operated on about 1,500 people so far, but they're all spread around the world. A lot of them will be in Germany. I haven't been in contact. I haven't tried to be in contact with them, is perhaps what I've said. I haven't looked to see whether there's a Vitas support group.
They're not doing like a research follow-up on your...
Yes, there is ongoing research. I don't know what the results are yet. It seems to me it's coming through rather slowly. I mean, it would be really good to see, what has happened to these 1,500 men, and not reports from the clinic itself, but an external research scientist checking them up independently and see how many are still alive and what their PSA levels and so on. So unfortunately, I don't have access to any of that kind of information. Now that you've sort of sparked my own interest, maybe I'll see if I can get some more information for my own interest. But as I say, I think what's impressive is this thing, 11.5 down to 0.32. That's pretty significant considering I still had a prostate when I had 0.32. I think those numbers speak. Dr. Anijar was very impressed, by the way. He rushed off to get a colleague to come and talk to me and hear about this. I think he'd heard vaguely about this. I think he said that one or two of his patients had already been to Frankfurt. But and the website's available in English and German. And the website link, it's here, vitasprivatklinik.com. But the link to this clinic was included in the invitation that you received by email to come to this meeting. So you don't even have to look it up. It's right there. You just click on it. Somebody thoughtfully put the link to the clinic that I was going to be talking about. Some of you might be interested.
You didn't discover this yourself. Your brother had discovered this.
Yes.
He find out about it.
Internet research. I never asked him in detail how he found out. It's going to come up with alternative. Prostate cancer treatment possibly brings it out. I don't know. and I never really asked him. I mean, he'd found it for me, so I just followed follow his lead. He went to Frankfurt, I went to Frankfurt.
Neil, is there anybody on the chat, or is there questions?
Oh, there's 3 chats. What are the chats saying?
So William wants to know what tests the clinics asked for before you went to clinic.
Oh, I didn't make a note of it. Just William, it was $1,600 worth of tests. I think that's just about everything. I think they measured the length of my toenails while they were at it. But it certainly was a heart test, EKG, and they took lots of vials of blood and what else did they do? I don't remember. But
MRI, probably CT.
no, this wasn't MRI. This is just to test whether I was a healthy enough specimen to survive the procedure. They don't want to spoil their track record by having somebody die on the operating table. But I don't know what the tests were. And I have to say, my doctor, Dr. Zygmunt, if any of you know him, he looked at the list and he said, I don't know what that is. I don't know what that is. So if he didn't know, I don't know. But it's a very comprehensive list. And it's just to see how healthy the patient is. Am I going to survive this procedure? Is it worth giving this procedure to someone? Is my health good enough to warrant this procedure? But the exact detail, if he really wants to know, I could go back and I'm sure I've got in my file somewhere a list of all of the tests that were called for, but very long list, such that my GP said, if you wait for this through the Jewish hospital, months and months will go by before they schedule all of these tests. So he said, look, you're spending a lot of money to go to Germany anyway. Let's move this thing along, spend the bucks and get the private clinic does it today. You walk in and they do the tests and you pay them the money and you walk out.
I imagine that if you contact the clinic, somebody wants to find out, they can contact them.
Oh, yes, of course.
Give them the information.
And they do have a wonderful woman. They know which side their bread is butter, and they know how important it is to be nice to the Anglophone potential customers, not just the Canadians, but of course there's more Americans, and America has the corner of the market on really wealthy people who can spend money on private clinics. So they have a woman called Charlotte who deals with these kind of questions. You can phone her up and say, what tests will be needed, and she'll get someone to send you. So what happened to me? Here's the list of tests, in my email box. Take it to my GP. He filled in, that form where they call for tests, and he put in X's everywhere on the box. Took it across the street to the private lab. 2 hours later, they'd done all the tests and handed everything over to me. X-rays, EKGs, everything they could think of.
Was procedure targeted cancer cells within the prostate itself?
That's what because my cancer cells at that time were restricted to being within the prostate. That was the only area that they treated. So the pairs of electrodes were entirely within my prostate, and they used like 3 sets or 4 sets because you do a little bit of the prostate at a time.
This procedure can also be used on that area that surrounds the prostate?
Yes, that's my understanding.
Even if the prostate has been removed.
Yeah, even if you've had a radical prostatectomy, if you get the cancer coming back in the surrounding tissue, the prostate bed, and that's quite common, by the way, it's about 8 or 10% risk of recurrence after a radical prostatectomy. I read that just yesterday from, I forget which, anyway, it's about 8 or 10%. So that's 2 people in this room, 1.5 people in this room, that kind of number. So it's a threat worth paying attention to. And yes, they can treat the tissues that is left behind. And I assume it works as well. I don't know exactly how they do it, but you can always contact the clinic and say, but you'll see if you go to the website that they do talk about this. In fact, this information I put in here about treating recurrences in the prostate bed, I took that directly from their website because I didn't discuss this with Dr. Stelling because it didn't come up. It might be coming up for me, by the way. I'll let you know. But yes, they can, if you had a radical prostatectomy, you could still go to them and have treatment for recurrences that are close to the original prostate.
Would you mind telling us how old you are?
Yes, I would mind. No, I'm 78.
What, in terms of follow-up with the clinic, are they doing any follow-up at all?
No, what they said, I mean, I could phone them and I've still got Dr. Heringer's number, I could phone him, but there isn't a systematic follow-up because what they said was, they gave me a list of what I should do. Do this, have an MRI every 3 months. So they gave me a list of follow-up things. And of course, the understanding was that if a subsequent MRI or a subsequent PSA test were to show some numbers that cause concern, they would be more than happy to schedule me for another procedure. You had a question, sir.
Yeah, I was, no, I was wondering how they identify the, like particularly like the prostate bed or something like that. How would they know where, which cells to target to be located?
Martin,
I think it would show. I'm sorry.
you can repeat the question for the Zoom.
Oh, yes, that's a good idea. The question from a gentleman at the back in a check red shirt. Everybody in this room, I have to say, does look like a prostate cancer demographic, doesn't it? This is the age. There's not a lot of women in the room. I wonder if you could get around prostate cancer by identifying as a woman, because you wouldn't be eligible for prostate cancer if you could convince everybody you were now a woman. But anyway, I'm digressing as I often do. The question that was asked was, how do they find the recurrences in the prostate bed or the tissue near the prostate? I think it shows up on the MRI, but I'm not sure. As I say, I've never researched this. I've never asked them about this. They might have a procedure and say, well, if the PSA numbers are going up, then we'll zap the whole area. And that might be their approach. I don't know. All I know is that they believe that they can deal with recurrences either after their own treatment or after, as another person asked, can this treatment be used after a radical prostatectomy? And the answer is yes, even if the prostate's been removed. Just removing the prostate doesn't guarantee that you avoid all subsequent cancers, because if 1 or 2 cells have been shed from the prostate to the area around the prostate before the prostatectomy, then of course 1 or 2 cells can never be found with any kind of diagnostic technique. We haven't refined it to that level yet, but 1 or 2 cells can grow to be a noticeable tumor in the space of 3 years or whatever, 4 years. So just because you had the prostate removed doesn't mean you're guaranteed everything's. And that's always the problem with cancer. I'm repeating the obvious, but the treatment for cancer is get rid of the primary tumor as thoroughly and as soon as you can. That may be too late because that primary tumor may have shed some cells throughout the body that are growing before you went ahead and did whatever treatment for the primary tumor. So it's always the metastasis that's is the problem. The primary tumor never kills you.
PSMA, wouldn't that be kind?
I think
Was
so.
probably a
It's
PSMA.
It's pretty sensitive, yeah.
What's a PSMA?
It's a new scan that's been around, I don't know how long, but it detects very small tumors, the kind that you're describing, and then they target those areas with radiation.
Oh, okay.
Well, if I can say, Wayland has had this procedure done a number of times.
Okay, so they pick up a single small tumor and then they zap that with
Pencil dot.
a pencil dot, and then they
That detection.
yes. What say again? PSMA?
Yes.
PSMA. And so you had several, and that's worked with no serious side effects?
Yes, no side effects. They just went with the radiation and got them.
Okay.
It's very, very small, targeted.
Mhm.
This is just for
Locations.
detection. It's just
Okay.
for
The PSMA is the detection. And obviously, once you've detected it, then you can train the external beams. And I assume it was done with external beams. They didn't use seeds for this.
Yes.
The
Certain ones, the procedure was actually done at the
at the Jewish,
Mhm.
but they couldn't do it. Their radiation equipment could not get that fine, but at the Glen, they could go after it. with a
Okay.
machine.
That sounds to me like a good way to go. So how many approximately of these procedures have you undergone?
Twice.
Twice. This gentleman has undergone precision radiation treatment for tiny tumors twice. But even with the most precise measuring techniques possible, they couldn't possibly detect a single cell that's about to start growing, because every tumor grows from a single cell, including the original tumor. So it sheds a single cell, and then after so many months or years, it becomes big enough to detect with the PSMA test.
We have an online question from William. Maybe you want to ask him.
Okay, where is the question? I probably can get it, chat.
So, William, you're unmuted. Ask your question.
Oh, no, you answered the question. You simply said I can write the clinic and
What?
oh, it was just about the test. But the other question I had was, is there any thought of bringing this treatment?
Oh,
William,
Yeah.
William, can you hear us?
Yeah, can you hear me?
All right, well, next.
no, do we need to plug this back in?
No.
Okay,
What is the success rate of CT versus conventional radiotherapy?
I don't know. As I say, I haven't been able to find any external sort of scientific analysis of what's happening at this clinic. They themselves boast of having a very high success rate. In fact, I think they claim that it's pretty well kind of guaranteed successful, at least in terms of dropping the PSA to levels such as mine. Just to repeat, I went from 11.5 to 0.32, and considering I still had a prostate that would be putting out some PSA, 0.32 sounds like a pretty good number. But no, unfortunately, I don't have access to any of this. As far as I know, nobody's published research on this kind of treatment specifically for prostate cancer. It's used in other kinds of cancers already. I believe in skin cancer, but I'm not so sure. But unfortunately, I don't have any definitive statistics on the success or failure of but they claim to have operated on 1,500 men. Yes.
For radiation, typically go in, have 20 to 35, 37 treatments in there. You're in the room for about half an hour each time. How would you describe your treatment? How many times did you have to go? Was it all done in one day?
Oh, it all done in one shot. It was just like a 2 or 3 hour operation, and that was it. So they operate, they insert the needles, zap the current between the needles, and so it's all done in an afternoon. I went in at 1 and was out by 4 or something like that, or I was conscious by 4.
You have a local or a general?
Oh, general. They don't want you moving in the procedure. I think the general with the full muscle freezing as well.
Perineum or through the belly?
Through the perineum, which, by the way, is the way that, according to the clinic, all prostate biopsies should be through the perineum and not transrectally, as they like doing it, because the transrectal biopsy produces a serious risk of getting prostatitis. In fact, I got prostatitis from a transrectal biopsy, and it wasn't pleasant at all. So if you feel like being a little bit assertive with your doctor, ask for a perineal biopsy instead of a transrectal biopsy. They like to do it transrectally. It's a shorter distance and easier for them to get it precise. But because it's through the rectum, you've got a huge risk of infecting the prostate cancer with bugs from the colon. Yes, gentleman at the back.
I sent you home with a catheter.
Yes, 2 weeks catheter. And as I said, I'm sure you all know what catheters is all about. And so I was flying in airplanes with catheters and all of these things. They gave me a nice letter, by the way, to take to the airline company that was flying me to Marseille. And I handed over the letter, and they gave me a very good seat near the aisle and near a washroom. They were being very considerate.
Mark, I have a question. While they're doing this procedure, they've already mapped out the prostate, where they're going to put these needles? They don't need to do any MRI or
Oh, they didn't.
ultrasound while they're doing it, or you
No.
don't know because you were under,
Well,
you had general
who,
anesthesia.
who knows what they were up to
Yeah.
during the operation? You're always putting yourself at the mercy of some really bad jokes, aren't you? No, they did the MRI, and I can't remember, it was the day before, probably 2 days before the procedure, they did the MRI. Then the day before the procedure, they talked about the MRI, and then they did the procedure. They have a thing, you go in on a Tuesday, and then you do things on Wednesday and Thursday, and then you're out on Friday. It's like I think I stayed 3 nights. And of course, it's a very well-run clinic, and you've got hot and cold running nurses all through the night.
Was the food good? The bed's good? I mean, it's a fancy hotel.
It was like a fancy, it was, it was a hospital bed, with the electrical up and down. So a German-run private clinic is going to be pretty well-run, isn't it? They're not, and as I say, it's I couldn't complain about anything about the treatment. If I had the smallest problem, the nurse was there right away with a, painkiller or a suggestion or whatever.
So you talking about a painkiller? Was there any pain?
We call it discomfort. Not a lot really. I was really, it's really very mild, except that I had this reaction to the catheter. Has anybody else had a bad reaction just to the catheter? Because the curious thing in my situation, when I had the HIFU, I had a catheter for 1 week and it was nothing. My body said, okay, this is what we're doing. We'll do it for a week, and took it out, and I barely noticed it. But this second one, perhaps because the prostate had been more severely zapped, the whole prostate had been zapped rather than just a local treatment. My body said, no, well, let's see if we can expel this catheter. That's basically what my body was doing, was trying to get rid of the catheter and not succeeding. So even after I did remove the catheter, the pain endured. They at first thought that I had, in fact, contracted prostatitis, and the hospital did the blood work culturing to see what kind of bugs I got in my urine. But they also said, no, you don't have infection because your blood levels are fine. You've not got an infection. We think it's just a bad reaction to the catheter. But once that was over, but if I hadn't had that catheter reaction, it would be, I felt pretty wiped out for the first few days. I was pretty well sort of in bed most of the time for just a few days after I got to my brother's house. So I couldn't enjoy his swimming pool, unfortunately.
Well, the catheter.
What?
You had the catheter, you go swimming?
I suppose you could. Do anybody. I certainly wasn't going to go swimming with the catheter.
So, I don't know if you said you were talking about side effects compared to some of the other treatments. So there's no impotence or incontinence with this treatment?
No, because you see
You might want to repeat that.
oh yes, Neil just asked, is there with either of these treatments, is there a risk of either impotence or incontinence? Well, you've still got the prostate, so you don't get the incontinence, because the problem with the radical prostatectomy is that they had to reattach the urethra to the bottom of the bladder, and that's not an easy thing to do, and the muscles don't necessarily work that super well. But that part of the anatomy has not been touched by the treatment, so that doesn't induce incontinence. It doesn't, and you're not getting close to or damaging the nerves that control erection, so it doesn't cause impotence either.
I do have an online question.
Go ahead.
Not exactly related. Is there any treatment that they offer for enlarged prostates?
I think they do. I think they have a treatment, but that would be a totally different thing, because you'd have to, I don't know.
Contact the clinic.
Contact the clinic. It's quite a big website, but I think I saw something about dealing with BPH, benign prostatic hypertrophism, but I don't really remember.
all the questions I got online.
Oh, yes, another question at the back.
Why is a catheter required? Well,
Oh, because the urethra goes right through the center of the prostate. I'm telling you what I'm not allowed to tell you. And so if the prostate is in any way sort of damaged, then it swells. And the danger is that it swells and nips off the urethra. And once that happens, and you can no longer get urine out of your body, then you are in serious trouble. So they put the catheter all the way into the bladder so that there's guaranteed a route for the urine to get out of the body while the prostate is settling down.
okay, I was surprised at that because like the radiation has a catheter.
You get a catheter for that as well? Well, oh, you didn't? Well, has anybody had radiation and had a catheter? I don't know whether it's common or not. Perhaps the radiation is more targeted, but anything that makes the prostate likely to swell, you see, my treatment zapped the whole prostate in an hour and a half, so the prostate swelled up in reaction.
Oh, I thought it was charming. You said you had 4 electrodes.
Well, I had pairs, yeah, but you're targeting different parts of the prostate, but various parts of the prostate have been zapped. So various parts of the prostate swell in reaction, just like a bruise. And there's a huge danger that the combined swelling of the different parts of the zapped prostate will combine together to compress the urethra and block the passage of urine. And if you do that, then until that blockage is cleared, you're in serious trouble. So as a prophylactic measure, they put in the catheter and they leave it in for 2 weeks to guarantee that you won't ever have this kind of blockage. And when I think I said there wasn't much follow-up, but I think I did talk to Dr. Heringer a couple of times. And once I removed the catheter, his very first question is, are you still urinating? And I happily said yes. So they're aware of this hazard. He was concerned that even after 2 weeks, the prostate might swell up and might block off the urethra.
Right, irradiation is killing the prostate, right? This isn't killing the prostate, so the prostate cells are still alive and they can get inflamed. When you're killing the cells, it's nothing to get inflamed.
Well, the radiation is targeted too. I mean, it doesn't necessarily get all of it.
Yeah, but the area, I guess, didn't work.
Can ECT be used if you've had the prostate removed?
I'm sorry?
Can ECT be used if you've already had the prostate removed and you've had follow-up radiation years?
As far as I know, yes. Now, what do I know about it? I'm just a dumb patient, but this is my understanding from reading the website. But phone Germany and ask to speak to Charlotte, and she'll be very charming woman. She'll get you the answers pretty quickly. Sorry, I missed that.
I said, I think that follow-up radiation may have affects the tissue.
Yes, but don't ask me. Ask the providers. Obviously, if you had a whole bunch of radiation, it's going to make subsequent things more difficult. But as I understand it, once you've had serious radiation, you can't have any more radiation. But maybe I'm misunderstanding that as well.
They don't like to do surgery either on it.
Oh, okay.
Are we agreed that like split each out, put the cheese, take the cheese out of between 2 pieces of bread, no problem, but after you grilled it, take the cheese out, no story, right?
You have a cheese salad?
Sure for with breast cancer, don't read the won't do a repeat.
Yeah. Yeah, are we about the end of your questions now?
What was the elapsed time between you had the second showing of the cancer on the other side of your prostate and your operation was completed?
It was a few months because sort of going through all of these decision processes and getting appointments at the Jewish, and then finally contacting the clinic in Germany, and then them saying, here's this huge list of tests we want you to have beforehand. I forget the delay. It was probably 2 or 3 months at least. But they of course do their own MRI with what they consider to be the best equipment they could possibly have, and use that to guide the diagnosis and the treatment.
Do you remember if before they did the MRI, whether they gave you some kind of contrast agent?
Any kind of,
Contrast agent?
oh yes, I think yes, intravenous contrast agent. For the whole time I was there, I had a thing in my arm so that whenever they wanted to get stuff into my bloodstream, they could. And I do remember that but isn't that standard with an MRI, the contrast agent?
Without,
Okay, well, they used a contrast agent, and they also used a rectal coil, which I don't believe that they use at the Jewish. They say that by putting this coil in the rectum, they get an even better picture. But so they did the two things, the adjuncts to the MRI.
that's unusual. I don't know. It may depend on the.
Yeah.
I've heard of other kinds of coils used. I did the MRI at the lake shore before the biopsy, so
Okay, I mean, no coil.
no contrast, no rectal coils.
Okay.
It was a three turbo? Yeah, it was a powerful machine.
Oh, the MRI is a powerful machine.
Lake shore.
Okay.
Out of curiosity, what is your next step? Like, I mean, you're got, how do you monitor yourself? What do you do?
Well, I'm following the instruction I got from Germany. Keep having MRIs, keep having PSA tests.
Okay, so they really want you to keep following yourself.
Oh, yes, yes.
Class.
So they say an MRI every 3 months, and now that's a kill, I think. I'm not having them that often, but I'm having, I had an MRI somewhat recently and a PSA test. So I'm in the process of seeing what happens next.
You're being followed by a local doctor.
Yes, by the Jewish. And they're quite happy to do this, by the way. They don't say, oh, you went to Germany, had treatment, we're not going to touch you anymore. My own doctor was very interested in hearing about the procedure I'd undergone and was very impressed by the PSA numbers. But now he's following it up. So I will stay with the Jewish and have radiation treatment or whatever they recommend, or I'll consult with Vitus and see what they recommend and what their prices are now and whether I can afford it, given all the special assessments I'm facing in my condo.
Are there any more questions? We're finished with Zoom. People, any questions on Zoom still?
There's only one person left on Zoom.
Well, there's a bunch, but
Oh, I can't see them. It's the way my screen is set up. Okay,
That's you.
that's me. Oh, there they all are. Yes, okay. Oh, they're still there. Okay. Hi, everybody. Waving hands. Okay, have I stopped sharing?
yeah, I stopped your share.
Oh, you stopped the sharing. Okay,
So John, you want to make some final comments? Thanks.
Well, yes,
there you
I'd
go.
like you, I'd like to,
Yeah, take his microphone.
oh, okay.
Just put it here.
Okay, good. So Martin, I'd just like to give you this as a thank you for doing this presentation.
Oh, thank you.
It's a hand made pen
Oh,
here in Montreal. Somebody does this for us
mhm.
on our request. So
Well,
thank you
thank
for
you.
doing the presentation. It was
Okay.
very good.
Okay.